We've mapped the genome, clocks to measure aging, and can now predict biological age with a few drops of blood. But here's the kicker. None of it is ready for your doctor's office. Why? Because turning a lab discovery into a clinical tool is a lot messier than you think.
Hello, everyone. Last episode, we discussed about a novel factor that by itself could rejuvenate cells without the danger of tumors or loss of cellular identity. Discoveries like that get us excited and often make us wonder, when are such therapies be available in the clinic, right? But there is a lot of considerations to be made before translation reaches the bedside table. And today, that is exactly what we'll be discussing.
And for this conversation, we have the lead author of a key paper titled Challenges and Recommendations for the Translation of Biomarkers of Aging. Dr. Chiara Herzog is a molecular biologist and aging researcher at King's College London with a focus on translating biological age biomarkers into clinical and public health applications. She leads work at the intersection of epigenetics, bioinformatics, and translational geroscience, aiming to bridge discovery science with real-world impact. Chiara, welcome to the show.
Thank you so much for having me on your amazing podcast. It's a great honor. So looking forward to speaking to you.
Yeah, it's so nice to have our first female interview. It's the first one in the show, so I was starting to feel a little bit lonely here. But anyway, all jokes aside, I would love to hear from you what sparked your interest in aging biomarkers in particular. And was there something about measuring biological age that fascinated you? What's your story?
Yeah, so I mean, I've been always interested in how the body works, and obviously quantifying what happens inside a cell is amazing. But actually, I only got into aging biomarkers a few years ago. And really, it came through the work that I was doing on epigenetics in the context of cancer research. That was work that I started in 2020, and I was really fascinated how much we can tell about a person by just looking at their epigenome. For instance, whether they're smoking currently, whether they ever smoked in their life, whether they have cancer, or what their risk might be for that in the future. So that was something that I found really exciting. And we started doing a study into cancer prevention and measuring how that would affect molecular biomarkers. And obviously, because cancer and aging are so closely interlinked, I took a step back and thought, okay, wait a minute, actually, what about aging in general? And I think that's kind of my story of how I ended up in this field, and it's been extremely exciting. So yeah, that's where we are.
Yeah, that's amazing. Funny story. I also jumped from cancer into aging. So I feel like we have very similar paths in that way. But let's talk about
Absolutely.
this paper, which is such a timely piece, I would say. It's summarizing sort of the big roadblocks are to getting aging biomarkers into the real world use cases. So can you walk us through what you hope to achieve with this paper overall?
So this paper was actually a product of our first Biomarkers of Aging conference that we held in December 2023 at the Buck, which now already feels like it's so long ago. But that was the first meeting we organized that was dedicated specifically to aging biomarkers. Of course, there's lots of other conferences, but we thought, let's use the momentum that we have, bringing all these people together to actually see, okay, what do we need to do next? And myself and other leading team members working on this manuscript were serving panelists and speakers at this conference to find out what is really the key challenge that they face or they see for the field. And yeah, that was kind of the idea behind it, because even though, we can't solve everything at this point, even finding out what we need to solve is hopefully a right step in the next direction.
Yeah, I guess a few episodes ago, we speaking with Jesse, and the whole consensus of what is a biomarker, what a biomarker should be considered as a biomarker per se. It's a whole new thing, because in aging research, we often disagree with a lot of concepts, and we don't really have this unified vision of aging itself. So it's really hard to come into a consensus. So it's really nice that you guys are trying to get this out. But in your paper itself, you have highlighted there are several challenges. So not just in the identification of the biomarkers, but how you standardize, how you reproduce, things such as data access. So there is a lot of, I guess, steps, or there's a lot of considerations to be made. Would you mind us talking a little bit about those and what would be the true bottleneck, like how this all come together?
So there's obviously a few bottlenecks that are of different magnitude and scales. I think all of them are important, but some of them might be a little bit easier to tackle than others. So thinking, for instance, about reproducibility, actually, this is something that's more an analytical problem or kind of an engineering problem. So we have done this separately in the context, for instance, of bringing a cancer biomarker into the clinic. Once you've done your discovery, basically you need to spend a lot of time in making sure that it's all meeting the standards there. But that's actually, once you have the time and willpower to do it, that's doable. I think what's more challenging are other more conceptual things, like, for instance, how can we actually apply a biomarker in the clinic? And I think I was also at Longevity Summit Dublin last week, and a lot of people are asking me, like, okay, when can we use this biomarker? And I think for me, what we really need to show is that it actually works in a clinical setting and does what we're intending it to do. So, for instance, are we stratifying patients or are we quantifying the intervention? And I think that's not quite clear yet. So I think we need to work a lot more on the clinical side of it to understand where would we apply these biomarkers and do they have benefits that we say that they do? Because I think a lot of the time as researchers, we're a bit disconnected from what's happening maybe in the clinic. And I think this conversation is quite important.
Yeah, I agree. But I also have to admire something in the paper. It's not just all doom and gloom that you point out, not just the challenges, but you also sort of almost lay out a roadmap of what can be next and what should be done. Can you share some of your top recommendations that you think that the field needs to prioritize right now?
Yeah, great. So I'm glad you think so. We did our best to try and make it useful because obviously it's easy to criticize, but maybe a little bit more challenging to find out what we actually can do. So I think one thing that we can do right now is work on standardization and also to some extent data sharing. And this is something that we've been trying to do with the Biomarkers of Aging Consortium, where we build tools and data architectures for sharing data. Obviously, we haven't solved the problem of data protection in terms of how to share it yet, but that is something that we are quite interested in. We're also working with the Longevity Biotech Association on recommendations for biomarker data collection in early phase clinical trials, so kind of going beyond what's done typically in academic research. And hopefully that paper will come out soon. But as with any community standards, it really depends on how many people adopt it. So it's also, we can't just say, okay, we've done it. We really need to work with people to say, okay, maybe you can also adopt these standards and that will help. I think what will also be something that we need to start doing soon is looking at more interdisciplinary collaborations, including with clinicians. And this is something that I've already mentioned before. I think it would be great if we can have some more research into, for instance, applying a biomarker in a clinical setting to stratify patients, comparing it maybe even to chronological age and seeing, okay, do we get an added value? And this is also something that we have started doing as part of the consortium under work led by Dr. Luisa Baca, who's been working with us over the last year. It's essentially a paper to see how can we redefine age in a clinical setting. And hopefully that will be a useful perspective for the future. Also, I think there's some work ongoing at King's College London, where one of my colleagues, Dr. Carly Welsh, is looking at evaluating biomarkers of aging in the context of geriatric oncology. And they're basically looking at patient survival and patient outcomes. And I think that's extremely exciting because that's really something where we can see this could actually be useful in maybe 1 or 2 years already if we continue down this path.
Yeah, that is amazing. It's, there is a lot of work that is happening out there, and I fully agree that we should be collaborating much more with clinicians, but sometimes there is a challenge in itself because if you have those clinics, usually they obviously want to profit, right? So why should they share their data? It's understandable, but it's also a problem because it sort of like slows down the field quite a bit, right? And I guess another issue that we might have is that usually we have cross-sectional data, and it's really, really hard to, have those longitudinal data sets where you're having, multiple measurements of the same person. And even sometimes, studying multiomics or like multiple layers within the same person, it's also kind of gives a fragmented vision of the whole picture. So do you think for us to really move to the next thing or to the next stage of, those discoveries, do we need to reproduce, this big longitudinal multi-omics, everything together? Or what is your vision? Like, is it possible to do it right now?
Ideally, we would have a huge new study that's doing all the omics across multiple thousands of people and continents. And I think, there are some initiatives that might work like that in the future, but at the moment, we're obviously limited by funding. So we have to work with what we got. I think there are already exciting resources out there, including longitudinal data sets. Obviously, the majority of them weren't collected with the purpose of aging research, but we can repurpose them. And I think there's a lot of exciting stuff in the US, in the UK, and also on your side of the world with the Dunedin cohort. I think that's a really exciting study as well. That being said, I think there are several efforts that we can do. One thing is, as you mentioned, including clinics of people that are already applying biomarkers. I think it would be extremely exciting if we could actually get them to share data to some extent, because these are the most advanced in terms of technology that is being used. So if they are applying these more innovative biomarkers and we can actually see what's happening to patients, that would be exciting. Another thing that we have been starting as part of the consortium was launching the longevity study, which we piloted last year and collected 100 or samples and data from 100 participants over 3 days. So it was actually relatively lightweight in terms of management of the participants.
Happening again this year, right?
Exactly. So we're expanding this year. So this year it's hopefully tripling in size, but obviously, that's still only 300. So the vision is that we're actually sharing resources in terms of how to recruit participants, how to standardize these questionnaires and SOPs. So it makes it a lot easier for people elsewhere if they want to do a similar thing. And of course, people can expand the study. So it's quite a minimal questionnaire that we have. So people might want to ask more questions or gather more data. But the idea is that we have kind of this common ground. And then ideally, we would in the future have these sister studies where we can share data across different locations. And hopefully that would then have some sort of a decentralized aspect to it, also allowing it to be a bit more diverse, because we could do it in many different places of the world. Obviously, possibly the Biomarkers of Aging conference is not the most representative group of people, but hopefully that can be enhanced.
Going back to some of the issues that you pointed out, fast forward 5 years, let's say, what does sort of some of these clinical applications for aging biomarkers even look like? Would that be sort of annual blood tests, clock-based drug trials, something else that you envision?
I think it will depend a lot on the evidence we will have gathered. I think one thing that's possibly a more low-hanging fruit in terms of how easy it is to do, but how much benefit it could yield. I think it would be, for instance, stratifying patients or helping clinicians with certain aspects of treatment. So intuitively, many clinicians are already using either age or basically how old or young the patient looks for their age, which is essentially a type of biological age. So that is already being used, but if we had something that's a bit more objectively quantifiable, that would be great. And that could then possibly also help with screening programs that have certain age thresholds or risk stratification. Of course, ideally, it would also be something that we can use to monitor interventions, but I don't know if we will be able to get that evidence very quickly. But obviously, this is the dream of what we want to do in the future. For annual blood tests, I do think it's interesting, but we will need to look at what is the cost benefit. It might be something that is very helpful for some people, but it might not be something that is recommended over a broad population. So I think we will have to see.
Yeah, and it's not just being helpful in a sense, but it might not be accessible to worldwide.
Exactly.
So, all the studies that we talk about, they're usually very European, US, high income countries sort of based. And
Absolutely.
it might not be the case that it's going to be available for everybody to just go and do a blood test. But I guess we have to start somewhere. And the idea is, how can we potentially, have things that are easily measured across everybody that could represent, such marker in the blood, or and I think the field has advanced quite a lot in this space of a very short time. As you mentioned, these days we can measure biological age by just taking a picture, for example, by just looking at the face, and that sometimes can even correlate to some organ health and whatnot. So I guess there is a lot that has been advanced, but there is a lot still to come. So I guess this brings me to sort of like one final question, which is like, do you see these aging biomarkers as potentially diagnostics or predictive tools, or even drug targets themselves? Because I guess the whole idea is to come from not managing aging anymore, but like, how can we avoid it, the process altogether, right, in a healthy way, talking about extending health span. So how do you see this developing?
Yeah, that's a great question. I think what they're really good at the moment is probably more in the predictive space. So we can tell a lot more about future health outcomes at the moment. I think for diagnostics, we probably have other better tools at the moment, at least, because, it might be certain diseases. And I think this comes back a little bit to the point that aging itself is not a disease. It doesn't have an ICD-10 code. So that might be quite tricky in the current healthcare space. But certainly for prediction, I think that would be something that can be done. Obviously, I've mentioned before, the idea would also be to ultimately use them as what we call surrogate endpoints in trials or interventions, but that will be maybe more tricky. And I think it's super exciting to possibly see them as drug targets. I think one thing that we really need to ensure before is that what we're measuring with the biomarker is actually causal to the aging process. Because I think, at least for my end, for a lot of the epigenetics, we don't really know what are we capturing. And there's like some exciting stuff on like finding causally enriched biomarkers and these sorts of things. But yeah, that's tricky. I guess it's maybe a little bit more interpretable for other omics, like proteomics. We have a little bit more one-to-one translation, but yeah, I think there's some more work to be done there. So we're not optimizing a biomarker that might actually not reflect the underlying aging process. But I'm sure there's really exciting stuff coming in the next few years about that.
Yeah, this has been really insightful. Thank you for walking us through all the amazing work that you're doing, especially in the field of aging biomarkers. Now, before we let you go, where can listeners find more about your work? Twitter or LinkedIn, somewhere you're very active?
Yeah, so please do connect with me on LinkedIn. I also have a website which has a bit more information on my research for anyone who wants to read up on it. But yeah, just reach out to me there. That would be great.
Okay, well, thank you so much, Chiara. I guess this is it for today's episode of Decoding Longevity. And if you enjoyed the conversation, leave us a review and share with a friend who is into aging. So I guess everybody should be, really. But yeah, thank you so much for your time.
And thanks to our listeners. We'll drop the link to Chiara's work in the show notes. Thank you for joining us at Decoding Longevity podcast. See you next time with some more exciting science.
Thank you for having me. It was great fun.